Ultra safety and ultra performance. That's what Braun's Ultrasite needle-free IV system delivers. Braun's Ultrasite Luer access device is a needle-free closed system. With its innovative positive displacement design, Ultrasite reduces patient risk of IV catheter occlusions. Activated by a Luer lock connection, the Ultrasite Luer access device is easy to clean and disinfect. Let's explore the uses, features, and benefits that make Ultrasite the ultimate in clinician safety and clinical performance. This patient has a dual-lumen peripherally inserted central catheter in place, commonly called a PICC, that is being used to administer IV fluids and antibiotics. On the distal end of both PICC lumens is an Ultrasite Luer access device. One lumen is connected to the primary IV line that supplies fluids and antibiotics to the patient. The second lumen is not currently being used. The healthcare clinician is at the patient's bedside preparing to flush the unused lumen, a procedure that is part of routine maintenance at this facility. The clinician has already prepared the work area and the necessary supplies. In compliance with best practice procedures, the clinician will follow aseptic technique and has performed proper hand hygiene. She is now donning gloves before accessing the patient's IV line. The clinician continues following best practice by disinfecting the Ultrasite Luer access device before access. According to facility protocol, the clinician scrubs the access top of the Ultrasite vigorously with an alcohol pad, twisting back and forth in a circular motion. The alcohol must be allowed to dry, and the Ultrasite access top must not be touched after it is disinfected. While the alcohol is drying, let's take a closer look at the exterior design. Ultrasite is a one-piece needle-free Luer access device with a rigid Luer guide access top that does not allow for needle access. This helps enforce compliance and reduce needle stick injuries. The Ultrasite Luer guide access top with an external seal reduces the risk of unintentional touch contamination. The Luer guide design makes connection easy by guiding the Luer taper into place. This design reduces potential slippage of the syringe during connection. The male Luer lock connector attaches securely to the IV catheter line or extension set. After the clinician has properly disinfected the Ultrasite Luer access device, she continues the flushing procedure. Ultrasite supports both saline-only and heparin flushing options to meet any healthcare facility's protocols. If the IV line is clamped according to facility protocol, the clinician unclamps the line. The Luer lock flush syringe is then attached by inserting it directly into the Ultrasite Luer access device, turning the syringe clockwise. This Luer connection opens the Ultrasite flow path, allowing for aspiration, injection, or infusion. Before continuing with the flush procedure, let's look at the internal design of the Ultrasite Luer access device. A view of the inner components and fluid flow tells an important story. Upon connection with a Luer lock syringe or IV tubing, the external seal and internal seal of Ultrasite open. Then, pressure on the internal plunger opens the flow path so fluid can flow through the device. This design allows the fluid to flow in an open, unrestricted way all around the entire closed plunger inside the outer housing. There are no hidden areas where fluid could accumulate and become trapped. The fluid volume retained by Ultrasite is only 0.3 milliliter. When the syringe or IV tubing is disconnected, Ultrasite automatically closes. The clinician has finished administering the final flush solution and is now ready to disconnect the syringe. Clamping the IV line is not necessary with the Ultrasite Luer access device. However, individual healthcare facility protocols may require IV lines to be clamped when not in use. If the IV line is to be clamped, it should be clamped after disconnecting the syringe to allow the positive displacement to occur. This will help decrease the incidence of catheter occlusions. It is important to remember that you should not clamp the line before disconnecting the syringe because it will prevent the positive displacement action from occurring. During this procedure, the clinician continually follows best practice by disinfecting the Ultrasite Luer Guide access top with alcohol before attaching each flush solution syringe and after disconnecting the final syringe. The innovative Ultrasite positive displacement feature must be seen in detail to fully appreciate how it decreases the risk of catheter occlusions. The positive displacement feature automatically pushes a small volume of fluid through the catheter when a Luer syringe is disconnected from the Ultrasite Luer access device. Let's watch that again in slow motion. Positive displacement prevents blood from coming back into the catheter lumen, which may cause occlusions. This is a one-time burst of fluid, 0.05 milliliter, not a continuous pressure. As a result, the catheter contains only flush solution. There is no backflow of blood. Positive displacement will also occur when the Luer connector of the IV tubing is disconnected from the Ultrasite Luer access device. Now that the clinician has completed flushing and disinfecting the unused PICC lumen, she will disconnect the completed secondary antibiotic infusion that is attached to the primary line through an integrated Ultrasite Y-Site Luer access device. The clinician has again followed best practice and aseptic technique by performing proper hand hygiene and applying clean gloves. The secondary line is disconnected easily by turning the Luer connection counterclockwise. The unique Ultrasite Y-Site design has an integrated fluid path. This design assures that drugs clear the line quickly because it is part of the continuous flow path of the primary line. A small volume of retained fluid, only 0.04 milliliter, remains near the top of the Ultrasite Y-Site Luer access device. After disconnecting the secondary administration set, the clinician follows best practice by placing a new sterile dead-end cap on the end of the secondary tubing set. The clinician then disinfects the Ultrasite integrated Y-Site with alcohol, allows it to dry, and flushes the Y-Site according to healthcare facility protocol. Best practice is followed by disinfecting the Ultrasite Y-Site again. Ultrasite offers innovative features and benefits to both patients and clinicians. The Ultrasite Luer Guide access top provides quick and effortless Luer connection, and it is easy to clean and disinfect. Ultrasite is available in multiple configurations to meet a variety of healthcare setting needs. Using only one design system, the versatile Ultrasite simplifies practice for clinicians and eliminates confusion in disconnecting and clamping procedures. The Ultrasite high flow rate of up to 200 milliliters a minute and high pressure capacity of 300 psi increase its utility within healthcare settings. Ultrasite is free of latex and DEHP. It is lipid resistant and non-hemolytic. Ultrasite has shown repeatable performance for up to 216 accesses and can be used in an MRI environment when it is secured out of the direct path of the imaging. The automatic positive displacement feature of Ultrasite reduces catheter occlusions by preventing backflow of blood into the IV catheter. The Braun Ultrasite Luer access device provides the ultimate in clinician and patient safety, ease of use, and clinical performance. The Braun Ultrasite Luer access device, ultra safety and ultra performance.